Hey guys, today we are going to learn about Kaposi's sarcoma. What is Kaposi's sarcoma? How do we diagnose it and what is the treatment for it? Hey guys, welcome to my channel Haha Med. Now let's get into the topic. Kaposi's sarcoma. What is Kaposi's sarcoma? It's actually a vascular malignancy caused by human herpes virus 8. It's common in HIV patients who are not on antiretroviral therapy. It usually involves the skin and the GIT tract. I'm extremely sorry guys for not using real images due to copyright restrictions. If anyone could teach me how to use images without any copyright restrictions, please let me know in the comment section. It's really important for you all to see these images for better understanding. They appear as reddish or purple spots on the skin and face. Now, how do we diagnose them? Endoscopically, they appear as reddish or violet flat macular-papular lesions to raised hemorrhagic nodules or polypoid masses. In biopsy, it shows as spindle cells with cytologic atypia, blood vessels proliferation, and extravasate red blood cells with hemosiderin deposition. There is no actually a cure for it, but it can be treatable for many years in systemic therapies like chemotherapy, radiation therapy, and surgery. Thank you.